Have you been diagnosed with fibroids or your scan report looks like Greek and you don't understand all the terminologies? So here's what we're going to do. Pause this video, quickly go get your scan report, and let's discuss location of fibroids. So welcome back. Why is this topic very important? People have fibroids, but the sizes and their location determines the symptoms as well as the options of treatment. For those just watching my series on fibroids, please check previous posts to understand what fibroids are and the risk factors. So where can we find these fibroids? We can find the fibroids on the wall of the uterus. We can find them in the wall of the uterus, and then we can also find them in the cavity. So cavity is usually where the baby stays. So let's start with the most common type or location of fibroid, which is the intramural fibroids. So these are fibroids that grow in the wall of the uterus, as you can see in the pictures. They can vary in size for all fibroids basically, so they may be very small or very large. Now for intramural fibroids, what symptoms can they cause? They can cause your period to be heavier than normal. You can have pain in your lower abdomen or pelvis. It can also affect your chances of getting pregnant. Now, for the very huge ones that make the uterus very big, the uterus then applies pressure on nearby structures, and then you have symptoms related to that. Next are the serosal fibroids, which are located on the outer surface of the uterus, as you can see. So that diagram was a diagram of a fundal serosal fibroid, and you can see how huge it is. Now, these fibroids can grow outwards and then press on surrounding structures, could compress the bladder, compress the intestine, compress the ureters, and then give symptoms related to that. Now we have the submucous fibroids. These are fibroids that are found beneath the inner lining of the uterus or inside the cavity, which is usually where the baby stays. They can cause severe menstrual bleeding. They may cause prolonged periods. They may cause intermenstrual bleeding. And yes, again, they may also cause fertility issues. This will be explained in another video. So we have pedunculated fibroids, which can either be submucosal, that is inside the cavity, or serosal, which is outside the cavity. And the pedunculated ones, it just means that they're on a stalk. So they're attached to the uterus via a stalk, and unfortunately it means that they may twist on itself, and if this happens, it may cause severe abdominal pain that may require surgery. I've had a couple of patients with pedunculated submucosal fibroids, which over time started to prolapse, that is descend, and eventually come out of the cervix and into the vagina, making its surgery a bit quite easy. Some people have fibroids in all locations. They have intramural, they have submucosal, as well as serosal fibroids. Not every fibroid requires surgery. Not every fibroid has symptoms. Understanding the location of your fibroids helps you to understand the symptoms you're experiencing or the symptoms you should look out for. Having fibroids is not a death sentence. Understanding your fibroid gives you the ability and opportunity to make the right decision.